For the next technique, we're going to do the anterior tibialis, which is the muscle that runs up the outer aspect of the front of the shin. The best way to find it is to feel the bony part on one side and then feel the soft part on the other side. We want to be rolling on that soft part. So for this, we can do it with a couple of different tools. We can use a foam roller. If yours is flat, that's great. I like this one because it's textured and I can work in the groove a little bit. If you don't have access to a foam roller, but you've got one of these peanuts, you can use one of these too. So I want to roll in this groove. So if I was using the peanut, I would place it on the ground like so, and I would try to get one of the balls to be in that groove on this side. If I'm using my foam roller, I'm going to have it where I've got my weight equal on 3 points, and then from there I can either work on the outside, rolling up and down, or if you've got a textured one like I do, you can work in the groove again. So what we're going to do is slowly work through that for 90 seconds. So as I'm working through that, I can, like with most of our soft tissue release techniques, roll through the front. On the outside of the shin, I can just scan by going up and down like this, hydrating the tissue by pushing the fluid out, and as I pass, pulling new fluid in. I can do pin and pull, where I'm actually going to locate a hot spot that I want to work on, stop on it, and I'm going to move my toes like this. That can be an effective technique. And then there's also the opportunity for cross-fiber friction. And cross-fiber friction is where I'm running against the muscle fibers. And in this case, the way I would do that is I would actually place it probably in this upper groove here and kind of work it side to side, like so. So all of those are possible. We're just going to work through the area. And again, we want to stay inside a frame of tolerance, meaning on a pain scale of 1 to 10, I want to be around a 6 or a 7. So a 6 or a 7 means it's uncomfortable, but it's tolerable. If I'm wincing or grunting or sweating or forgetting to breathe, I am outside a 6 or a 7. That's higher than a 6 or a 7. So try to stay inside the frame of tolerance for the technique. We're going to go ahead and switch sides. So now rolling up and down. And you may notice that different, on each side, it feels different. It can be tighter on one side than the other. It can be a lot of things. But the reason we're releasing this muscle in the front is because it plays a role in the hyperextension of the lumbar spine. We're working our way up important parts of the superficial anterior sling. This is myofascial sling speak for all the stuff that runs up and down the front of your body. But it starts at the anterior tibialis in that little groove. And believe it or not, if there's tension down there, it can resonate all the way up to pulling the pelvis forward and down and creating that anterior pelvic tilt that we're trying to resolve. So it's important to understand that nothing that we're doing in this system is arbitrary. It's all value added, and we are trying very hard to isolate different ways to release this tissue and make it as healthy and hydrated as possible, so that way we're restoring the most symmetry and balance to the body in its tensegrous system that we can. Got about 3 more seconds. As you can see, I'm just doing some pin and pull here. There we go. All right, on to the next technique.